looking for answers following the sudden death of a loved one.
Donnie Taylor died in August of 2017 at the Colchester East Hants Health Centre. He was in palliative care, but his family says his death was hastened when staff failed to give him enough oxygen.
Angela McIver has more on this CBC News investigation.
10 great grandkids, and I love every one of them just as much as I love my daughters.
Donnie Taylor knew he was dying. The 69-year-old suffered from COPD and lung cancer, but he had a plan to die at home, surrounded by family.
He thought, eventually, I would just sleep longer, and one time I just won't wake up. And it should have been that way.
Instead, Donnie Taylor died in hospital, and his family claims his final hours were far from peaceful. They say staff failed to give Taylor oxygen for 13 hours. He died that day. Health records obtained by CBC News confirmed Taylor was prescribed 5 liters of oxygen, but was only getting 0.5.
There is no way that anybody can look at us and tell us that they didn't know he needed oxygen to live.
The Nova Scotia Health Authority would not comment on this case. Since it was a serious reportable event that led to a quality review, the Health Authority says all details are confidential. CBC is able to talk about it because we obtained the documents. As a result of the Taylor case, hospital staff were ordered to review documentation practices related to checking oxygen administration levels throughout each shift and provide intentional education regarding the role of oxygen on the palliative care unit. A review was also done by the Department of Health. It determined there wasn't enough evidence to confirm the alleged lack of oxygen amounted to neglect or led to his death. Taylor's family says what bothers them is the attitude they say they faced within the palliative care unit.
It's a culture of acceptability. It's because you're dealing with somebody who isn't going to remember anyways. They're pretty much really not going to know, right? That is not acceptable.
The Taylor family recently filed a complaint with the College of Registered Nurses. They hope it will lead to disciplinary measures and finally allow them to move on. Angela McIver, CBC News, Folly Lake.
Dr. Dave Henderson is the Provincial Medical Director of Palliative Care. He can't speak directly to the Taylor case, but he says training staff is a priority they're working on.
Still in nursing schools and medical schools, we don't get as much training as we would like in palliative care. So we're working on that both provincially and nationally, but also for those people that are out working already, we've been offering education sessions.
In the last year, the health authorities at Northern Zone received funding for 3 part-time palliative care social work positions. A full-time social worker has also been hired to focus on grief counseling for the region. One of those social workers has been working closely with the Taylor family.
We'll hear more of this family's plight a little later in the program. That's our newsmaker just after 6:30.
And if you have a story you think Angela should be digging into,